friends, Dr. Alok again. It's been a long time, but now I'm back. I realized my purpose. So, how was the journey till now? How was your theory exams? I hope everything got done well. The exams are over. Now you are preparing for the practical exams. Whenever this term for the practical exams come, there is a fear inside us. एक डर आ जाता है कि क्या होगा हमारा? What will happen to us? How I am going to give the exams? So that fear factor always prevails with every DNB students, because unfortunately or fortunately, the way our exams are conducted is very much different from the MD exams. The pattern is different, the people are different. So for a different exam, you have to have preparation of a different level. So today in this lecture, I want to guide you how to approach a DNB practical exam, a warrior's mindset for clearing a DNB practical exams. So now, to begin with the warrior mindset, first of all we have to understand how the DNB practical exam is conducted. You know that there are long cases, short cases, spotters and x-rays, some drugs, all these things are put on the examination table. So you have to analyze how these things are put, what are the weightage of the marks and how they ask the questions. These are very important. To put it in a different way, before you go for war, you have to learn the terrain of the war. What type of mountain terrain is there, how things can go smoothly, where the rough patch is. So in approaching these exam, you have to have a clear view of the approach to that exam. So the number one point, the very important point, number one is you have to have the confidence. It is very important. Irrespective of everything, whatever you have, if you don't have the confidence, there is no chance of success. Forget about all your past preparations, whether you have studied in the last 3 years or not, whether you have seen cases or not, though those matters. But confidence at this time is of utmost importance. So, number one point is have the confidence that yeah, I will clear this DNB practical exam. Second thing, which I already mentioned, second point is learn the terrain of the war. Means learn the exam pattern. You have to know what exactly is the exam pattern. What long cases, which all system long cases are there, what type of short cases they can put up, what are the most common drugs which have been asked in the past, what are the x-rays and MRIs which are most frequently asked. Because if you know all these things and if you prepare about all these things, then during the exam you will be able to deliver better. I'll put it in a different way if you can understand. The DNB examiners judge you on 3 parameters: your knowledge, your skill set and your application of knowledge. You have to understand that you are a DNB scholar, you are a DNB student. To pass the DNB exam, what they require is that you should be at the prime of your basics, which you did in your MBBS exams. So your basics should be very clear. Second thing is you have learned the skills and the knowledge. So the knowledge and the skill, and in those 3 years, what the application of knowledge which you have learned, that they want to analyze. So you have to prepare yourself on these 3 aspects: the knowledge, the skill and the application of knowledge. These 3 things you have to inculcate in yourself for passing the DNB practical exam. Now the third is the strategy. You have to strategize your planning. You have to understand, sometimes what happens, we have always heard, a person is preparing for the last 2 years but he does not perform better during the exam. But another person, he has prepared in the last 15-20 days and he performs excellently in the exams. So you have to work smartly, you have to move smartly. Instead of working hard, you have to work smartly, you have to prepare smartly. And how is that? You have to find out, like in the case of a medicine exam, practical exams, you divide those systems. It's the central nervous system, the cardio, the respiratory, the gastro. So the cases will come from all these 4 aspects, and then there are the miscellaneous cases. They can put some cases of like ankylosing spondylitis, rheumatoid arthritis, they can put as a spotter. So you have to have a clear pattern of the examination protocols of these 4 systems. CNS, what they can ask, they can put a CVA case, the paraplegia, quadriplegia, GBS. They can put a multi-system disease like a bronchogenic carcinoma with the neurological presentations. So you have to know the history taking, the exact presentation of the histories, how to look for the general examination, Now the examination patterns checks your skills. The history taking presentation checks your knowledge, and the diagnosis and the provisional diagnosis checks your application of the knowledge. So the third part is strategize. You have 1 month or you have 2 months. You have to plan yourself. You have to focus on each day. You have to have a goal that today I'll write one case sheet, because this is very important. What happens most of the times when you are in the exam, there is a panic inside you. You have a limited time. You're taking a case. You have nicely taken the case, but unfortunately you are not able to write the case sheet. Mind it, examiners are very particular that your case sheet is complete. One fine day you cannot write the complete case sheet, so you need to practice. In the last, you have 1 month time. Every day take one case, go to the wards, see the case, present the case, and write the summary. Strategy should be like that you have 1 month time. You have to know the knowledge part, learn the basics: pulse, BP, temperature, what are the questions which can be frequently asked in those, which we are going to cover in the next some classes. So those basic things, how this examination is done, how you should do, check the plantar, how to take the nature, how to take the these all signs, nystagmus, how you have to see, what are the causes of this. So all these things you have to strategize that I have to do each day. I have to plan and I have to do like this. Your ultimate domain is your wards, where you're seeing the patients. Forget about your room, forget about your bed, forget your table and chair. Take your instruments, take your kit, go to the wards, see the patients, memorize, discuss with your friends, and learn. Coming to the fourth part, which is important, this is all you have done. This is strategy. Fourth, which is very important, is action. Now comes the main task. Everybody plans. One person will plan, I will do this, I will do this, but if you are not putting it into action, it is futile. It's of no use. So the most important thing now is action. And the best thing which I will say is, prepare the CNS kit, prepare the kit today night only, today evening only. Get your apron, run to the wards tomorrow morning with all your knowledge, go to the wards, see the respective cases, keep on palpating the liver, the spleen, the best, the correct methods. Just learn. If you have any doubt, ask your seniors, ask your professor. This is the time you can ask. This is the time when you can learn. Even if you have studied for the last 2 years, but you are relaxing right now, it is not going to deliver. This 1 month is going to pay back. Mind it, this is really going to pay back. So what I will tell you, you should take a pledge that from tomorrow morning onwards, you're rushing to the wards, you're seeing all the system cases each day, focus on one case, one long case, present it nicely. Even if somebody is not there to listen, just present it to the wall. Present it in the mirror. At least you will know where you are lacking, where the body language is not matching. And present the case, try to write the summary in a minimum time. Do all the reflexes properly, all the logical things which has to be done, because they are going to check your skills. If you are not able to do a proper examination properly, they are not going to pass you. Important. So now what you have done with the action, every day you have committed yourself that yeah, I am going to the wards, I am going to see the patients, I am going to write the case sheets. I am going to write the case sheets, and I am going to practice all the skills which are there. Now coming to the other domain. Fifth point, what is the fifth point? You have to collaborate all these things into one. If delivering it, now the time is coming. The final countdown is there. The day is near. You have to be calm. You have to be confident. You have to be calm. Yeah, the time is coming. That day is tomorrow. So at this moment, I have given the best what I can give. The whole month I have done it, what I was told, and I have followed. And I think I should deliver my best. The rest I should leave it to the Almighty. Thank you. I hope you like the video. Watch it again and again. And just remember one thing. It is not important that you have to go for a longer walk to reach there. That 1 month is there. Focus on this 1 month, and I think you can perform better. Thank you. Best of luck for exams.